Good morning. Today is International Hernia Day, 18th March. I am Dr. Alok Mazumdar, Consultant General Laparoscopic and Gastrointestinal Surgery in SevenHills Hospital Visakhapatnam. I would tell you more about hernia. Hernia is a condition where a part of the internal organ or tissue bulges through a weak spot in surrounding muscles. Now, what are the common sites for hernia? The common sites for hernia are the groin region, the umbilicus, or which is called the belly button, or hernia can also occur in places where patient has undergone previous surgeries. It can occur in the area just above the umbilicus and certain rare areas. Now, what are the symptoms of hernia? To start with, hernia presents as a small bulge in any of the regions that I have mentioned earlier. Gradually it increases in size, and as the bulge becomes more prominent, the patient is aware that the patient is having hernia. Now this hernia increases while coughing or while exercising. Initially it is painless, but however, as the time passes, it usually gets a dragging sensation, or sometimes there can be pain also. A swollen scrotum, like in the male, which part, there can be a hernia which can reach such size that it can present with pain. What are the signs of a hernia which gets complicated? Now, if the hernia is a complicated hernia, then the patient may present with vomiting, patient may present with fever, there can be suddenly a twist in the bowel which is there in the hernia, and it may, the bowel inside the hernia may get gangrene, and it may become a very serious life-threatening conditions. So let me tell you what are the common causes for hernia. Now there are certain hernia which can be there during from the birth onwards. However, certain hernias develop during the lifetime. Now this is because of some increased pressure within the abdomen, or there is a pre-existing weak spot in the abdomen. Sometimes when we strain too much during bowel movements, or we do strenuous exercises, then these patients are more prone to hernia. At times pregnancy, chronic cough, especially when the patient is having bronchitis or tuberculosis, can all lead to hernia. Now there are methods where we can treat the hernia. Now one must consult a surgeon to know which is the best method to treat the hernia. The hernia can be treated in many ways. One is the open hernia method, where we give an incision over the hernia and then we treat the hernia. The other is the laparoscopic method, where we give small incisions in the body and treat with various instruments. And one of the frequently asked question about these two varieties of surgery is which one is better. Now the laparoscopic hernia is definitely better because it gives very small incisions, and the pain is also very much less during the post-operative period. Patient can recover fast and go to the work at an early period, and also the complications are quite less. The length of the hospital stay also is less. Now, how to prepare your patients for surgery is that we must tell all the options to the patient, their benefits and their disadvantage, and depending upon the patient type of hernia, we suggest a particular procedure. Either it's an open surgery or laparoscopic surgery. In SevenHills Hospital, we are doing regularly hernia repair with laparoscopic surgery, including the latest technology. And these surgeries are well covered under the insurance and many TPA schemes. On the occasion of the World International Hernia Day, I would request that if any patient has a small hernia, they must consult the doctor as early as possible, because consulting the doctor at a later date will lead to complications and even life-threatening problems. My talk will be followed by a small PowerPoint presentation where you can see what are the causes, types, and the nature of surgery. Thank you.